Hey y'all, this is Rohit Verghese. I'm back again for week 15 of the QBank remediation. And so, for one last time, I have another set of 3 questions that I want to go over. The first question is a select all that apply question. It states, the nurse provides care for a client diagnosed with TB. The nurse notices surgical masks are available in the negative pressure isolation anteroom. Which action does the nurse take before entering the room? And so the first option is wear an N95 mask. Number 2 is wear a simple face mask with a face shield. Number 3 is wear a surgical mask. Number 4 is wear a personal protective gown. And number 5 is wear sterile gloves. And so the answer choices that I picked were 1 and 5. But 1 was wear an N95 mask, which is correct because when caring for a client diagnosed with tuberculosis, appropriate respiratory protection consists of an N95 mask or a powered air purifying respirator or PAPR. These devices are designed to protect the nurse from exposure to aerosolized droplets within the environment. This was the only correct answer for this question. Answer choice number 5, which I did pick, was incorrect. Answer choice number 5 was wear sterile gloves. For some reason, I picked this. Clean gloves are the standard for airborne precautions. We don't need sterile gloves when caring for a client diagnosed with TB. There's no point. Only clean gloves are what we use. So that's why only answer choice number 1 is correct and not 5. Moving on to the second question. So the second question states, the charge nurse supervises a novice nurse who is making client assignments. Which client is inappropriate to assign to an LPN/LVN? So this is a delegation question. And so the answer choice that I picked was answer choice number 2, a client diagnosed with chronic kidney disease who is due for a checkup with the healthcare provider. This is incorrect. This is because a client with CKD who is due for a checkup should require routine care. The LPN or LVN may be assigned to this client, so they can be with this client. It's not inappropriate for them to be with them. The correct answer was option number 3, a client with a history of diabetes mellitus who has an infected leg laceration. This is inappropriate to assign to a LPN/LVN because the client currently has an infected leg laceration that has to be assessed by an RN or a primary care provider to prevent prolonged wound healing, which can lead to bigger complications for clients with diabetes mellitus. And so that's why answer choice number 3 is correct and not number 2. Number 3 is the one that was inappropriate to assign. Now moving on to the third and last question that I wanted to talk about. This is a question that I thought was easy, but I guess it wasn't as easy as I thought. And so it's another select all that apply question. So an older adult male client has difficulty voiding. Which action does the nurse take to promote urinary elimination? So there were 6 answer choices. Number 1 was have the client stand when attempting to void. Answer choice number 2 is to advise the client to stop taking hydrochlorothiazide. Answer choice number 3 is teach the client to gently press on the pubic area when trying to void. Answer choice number 4 is have the client attempt to void every hour while awake. Answer choice number 5 is have the client drink at least 2 liters of fluid each day. And the last answer choice, number 6, is to perform intermittent catheterization if the client does not void within 3 hours. So there were 3 answer choices that were correct. I picked 4 answer choices in total. I picked 2 that were correct and 2 that were wrong. So overall, I got a net 0 for this question. I picked answer choice number 2, which is incorrect, because hydrochlorothiazide is a diuretic and is prescribed to control hypertension. This medication should not be stopped. And answer choice number 4 is incorrect because a voiding schedule should be established for this client. However, the nurse should have the client attempt to void every 2 to 3 hours while awake, not every single hour. I also picked option number 3 and option number 5, which were correct. Option number 3 is correct because gentle palpation when the bladder is full can stimulate urination. This action is appropriate when promoting urinary elimination. Answer choice number 5 is also correct because good hydration can help fill the bladder to stimulate urination. This action is appropriate when promoting urinary elimination. So answer choices 1, 3, and 5 were correct. I picked 3 and 5. I forgot to pick 1, and I picked 2 answer choices that were wrong, 2 and 4. And with that, those were the 3 questions that I wanted to talk about for this week. Thank you so much for taking the time to view these videos and for giving me this opportunity. And I hope you guys have a great day. Thank you.